Hello, good morning, colleagues in the Americas, and good afternoon to viewers in Europe and the United Kingdom. Welcome to Humanity First's next series in our educational webinars. And today I am very pleased to introduce and very proud to introduce to you Professor Jeremy Howick, who is no stranger in the academic world. He is Professor of Philosophy, Medical Researcher at Oxford University. He is Director of the Oxford Empathic Programme. He is the author of the award-winning book, Dr. You, who many in the field of mindfulness and self-healing will know all about. He needs no introduction. So without further ado, I'm going to hand you over to Professor Howick, who we're going to enjoy for the next half an hour or so, where he's going to share with us some of his wisdom about mental health, mindfulness, and the COVID crisis. Professor Howick, over to you. Thank you.
Thank you for that kind introduction, Dr. Hafiz. It's an honor to speak with you and be involved with the wonderful work of Humanity First. And as you said, I'm going to talk a bit about the relationship between the pandemic and well-being and some scientifically backed things we can do to take care of ourselves in the face of these challenges. Let me start with the story of Mr. A. It's a true story. Mr. A was a 26-year-old male who came to a hospital saying, "Help me, I took all my pills," and then collapsed. But as he fell down, the pill bottle fell out of his pocket, and he told the doctors he had taken all of the pills, which he said was a new drug for depression, which he suffered from. The doctors looked at the pill bottle, they saw the label. The label confirmed that it was a bottle containing pills of a depression drug, but the bottle did not say whether the drug was the actual drug or the placebo. Now, Mr. A had received the bottle the day before and had impulsively taken all the remaining 29 pills. He was fearful he would die of an overdose. He immediately felt he had made a mistake and asked his neighbor to drive him to the hospital. Now, Mr. A's blood pressure was dangerously low. It was 80/40. His heart rate was high, 110. He was lethargic. Over 4 hours, they had to give him 6 liters of fluid to keep his blood pressure normal. At that point, though, the head clinician from the clinical trial arrived and confirmed that Mr. A had taken the placebos, not the antidepressant drug. When he learned of this, Mr. A expressed a bit of surprise, then almost tearful relief. But within 15 minutes, he was completely normal and he was released from the hospital. So Mr. A did not overdose of a drug. He overdosed on stress and fear. Now, the negative effect of a negative belief based on stress and fear is called the Nocebo Effect, which is the placebo effect's naughty cousin, whereas the effect of the placebo effect is the beneficial effect of a positive belief. The nocebo effect is the negative effect of a negative belief, often, indeed always arising from stress and fear. Now, curious about whether Mr. A's experience was unique or more general, I looked more closely at this nocebo effect, and I was surprised how much information there was. It turns out the nocebo effect is widespread. And with some wonderful colleagues, I did a mega study, including over 250,000 patients like Mr. A, who had all taken placebos as part of clinical trials. It turns out that half of them, so over 125,000, report some negative side effect, like diarrhea, headache, nausea, depression, anxiety, asthma. 1 in 20, that's 5%, had such bad side effects, they had to drop out of the trial altogether. These negative side effects, to be sure, were not all nocebo effects. They did not all arise from, the negative beliefs. They might have arisen anyways as part of their daily life, and they misattributed these negative side effects to the experimental drug, in their case, the placebo. But in some cases, we did some deeper analysis, and it's clear that in some cases, the negative side effects after taking a placebo is caused by negative beliefs, like a self-fulfilling prophecy. So here's how it happens. In a clinical trial, people are forced to learn about everything bad that might happen to them. Then they must sign a paper saying they understand everything bad that might happen to them. Now, most of us in daily life ignore this stuff. If you take this kind of regular thing like paracetamol or aspirin, whatever it is, it costs a few pennies. And most of us don't read the small print inside. But if you were to read the small print, you might be scared. Here's some. Just for this simple paracetamol you've probably all taken. Allergic reactions, mouth ulcers, difficulty breathing, and if that's not enough to scare you, unexplained bleeding and hepatitis. When you were force-fed this information in a clinical trial, you could actually experience some negative side effects, like a mild headache, nausea, depression, or anxiety. This happens for many reasons. Basically, it's a deep stress response, which causes many things to happen in the body, including the increased production of neurotransmitters that make it easier for the body to feel pain. Let's look a bit closer at the stress response with a story. Imagine you're a caveman, and it's the dawn of human history, and suddenly you're frightened by a pack of wolves. Now, you freeze, your body's still, but inside your body a bunch of things happen. Adrenaline and cortisol rush through your veins to boost energy levels. Pancreatic levels are adjusted to give you more quick fix energy in case you have to fight. Your blood pressure and heart rate jump to give your muscles more energy. Your pupils dilate so you can see better even in the dark. Now, this astonishing response, this fight or flight response, is fantastic for helping you survive chance encounters with wolves. Now, in the imaginary story of the caveman might hurl a rock at the wolves go away, and then nothing happens. You let out a sigh, your whole body relaxes. You go back to camp and life is normal. Life as a caveman was uneventful. There weren't that many chance encounters with wolves. Now, let me ask you a question. How many of you wake up to this sound? Like this. Now, that sound is an alarm. What happens inside your body is that similar things to what happened to the caveman. All this fight or flight response gets activated. Now, to be sure, this fight or flight response in the short term, if you have to fight a wolf, is good. But when it's too much, when it overloads us, it's very bad. Too much stress is known to increase the risk of heart attacks, strokes, constipation, sleeping disorders, infertility, tooth problems, autoimmune diseases, asthma, diabetes, cold sores, pain, post-traumatic stress disorder, and slower wound healing. It almost certainly makes us more susceptible hosts for viruses. So it's safe to say that too much chronic stress is not a good thing. It's good to avoid it. Now, before I get into the relationship between this and COVID, let me make clear, COVID, the pandemic, is not just about stress. It's real. There are real physical problems, real deaths, real tragedies, like that of a 13-year-old Ismail Abduwahab who was forced to die alone. But alongside the pandemic, the viral pandemic, there's a pandemic of fear. Basically, what happens is the alarm goes off. We read the news, there's bad news, economic crises. They tell you about the number of deaths, the number of people infected, whether it's phase 1 or phase 2, what you have to do about it, should you wear a mask. On top of that, there's confusion, there's fake news, conflicting theories about what we should do, which causes stress even within families. People are arguing among each other what they should do, what the right thing to do is. So basically, this pandemic has caused us to permanently be giving ourselves negative messages all day. And it can be bad for our health. And another way to say it is that this pandemic, the coronavirus, or COVID-19, I'll use the word coronavirus for short, has laid bare our fragility and the fragility of the system in which we live. Because if you think of it, the virus is tiny. It's just 125 nanometers in diameter. It's entirely naked entirely invisible to the naked eye. Even if you took 1 million of these viruses and bunched them together, you wouldn't be able to see them. And these tiny little viruses jumped from a bat to a pangolin to a human, got under the human skin, and then spread around the world in a matter of weeks. And they're so clever, they can attach to our cells, get in the cell, and then release their RNA and convince our own cells to help them replicate. So in the midst of this fragility and the recognition of our own fragility, we need to draw on our own inner resources, including our innate instinct to connect and help each other. And when we do this, we can realize that we're far more powerful than we think. You have an amazing body. You are more powerful than you think. Let me just tell you a few facts about all your amazing bodies. So your bones, pound for pound, are stronger than steel. If they were laid end to end, your blood vessels could wrap around the earth more than twice. If you took the vessels of the less known lymphatic system and laid them end to end, they could wrap around the earth more than 5 times. You've got 30 trillion cells in your body. That's such a huge number, you can't even imagine it. The rational mind can't conceive of that number. Yet each one of these 30 trillion cells can replicate, reproduce, communicate, produce molecules, etc. Your body has its own inner pharmacy that produces endorphins to kill pain, happy chemicals like oxytocin and dopamine, your own inner surgeon which can cure scratches, etc. The list goes on. This raises the question, how can we activate these inner resources in order to help ourselves in the face of this pandemic? Before I say this, let me affirm once again that it's not just about tapping into our inner resources. We're also going to depend on external things, a great treatment, a vaccine, or the virus to decide to go away on its own. Now, I've studied what I call mind-body self-healing, which is called the placebo effect in medicine for 15 years now, done almost 100 studies to look at them. And there are many, many things we can do to activate these inner resources. I'm going to focus on 3. 1, the relaxation response. 2, the healing power of human connection. And 3, the power of giving. Let's start with the relaxation response. This is the one I think is the basis of many of them, and especially important, especially for all the wonderful Humanity First volunteers out there. So just as things like this phone are very powerful tools, they don't work if we don't plug them in. Well, we've got to plug our bodies in too once in a while to make sure we're on top of our own game. And to tell you about the relaxation response, the science of it, I'll tell you the history of how this science was discovered in modern science. Back in 1968, a Harvard professor called Herbert Benson, Dr. Herbert Benson, was doing blood pressure experiments with monkeys. Now that same year, the Beatles were getting interested in meditation, and they went to visit a guy called the Maharishi Yogi in India. And because the press followed the Beatles wherever they went, suddenly meditation became very popular. Subsequently, it went out of fashion, and now it's back in fashion. And these meditators were very smart, and they went to visit Herbert Benson. They said, listen, you're doing blood pressure lowering experiments with drugs. We can lower our blood pressure with no drugs, just meditation. Now, Herbert Benson said, go away, guys. I don't believe you. You must be nuts. But these guys were persistent. So eventually, Dr. Herbert Benson said, all right, I'll try it. I'll do an experiment with one condition. The Maharishi Yogi himself must sign up to the study. That way, when I show it doesn't work, he'll be exposed as a quack and a charlatan. But then when they went to visit the Maharishi Yogi, he said, sure, I'll sign up. He was thinking, I know it works, and finally I'll get a Harvard professor admitting it works. So the first experiment they did was with some regular meditators. They hooked up their brains to these electrodes and so on, measured their heart rate and blood pressure. And in the first experiment, actually the blood pressure didn't go down. But it's because the meditators already had low blood pressure. They were regular meditators. But the experiment revealed enough cool stuff for Dr. Benson that he wanted to do more, because Herbert Benson saw that when they were meditating, they induced what he called a semi-somnambulistic state, a sleep-like state, which the body was sleeping, but they weren't sleeping. So he did further experiments with people who were not regular meditators and found that meditation did lower blood pressure, at least in the short term. The way it works is, it's a whole other talk how it works, but basically it activates the parasympathetic nervous system. And Dr. Benson and others have done hundreds, if not thousands of studies and showed that whereas the stress response can be a risk factor for many diseases, the relaxation response, this meditation, can reduce the risk of high blood pressure, anxiety, general psychological well-being, pain, cognitive decline, multiple sclerosis, childbirth outcomes, schizophrenia, and PTSD. Note that I use the term relaxation response instead of meditation because Herbert Benson, once he found that meditation seemed to lower blood pressure, he was faced with a problem. Just as like he thought these meditators were crazy before he did the experiments, he was worried that if he promoted meditation, his colleagues might think that he was crazy too. So he chose what he called a scientific name, the relaxation response. And this wasn't altogether wrong because it's not just the Maharishi Yogi's meditation style which can lower blood pressure and induce this semi-somnambulistic state. Other forms of meditation, as well as traditional yoga, tai chi, prayer, can all have the same effect on the body. They're all slightly different, but they share a common substrate as well. So we use the term relaxation response, wrote a book about it, which became a bestseller. Now, all of you might be asking right now, how can I activate this relaxation response? There are 101 or 1,001 different ways to do so. You may already have your own way, and if you already know some ways, the most important thing is to be disciplined about doing it, preferably twice a day for 20 minutes a day each. But if you don't have time or you want some quick techniques, I'll just go through 3 techniques that take just a minute or less. The first is called a sigh of relief. The sigh is the body's natural way of releasing tension. And you all do it naturally sometimes, but you can do it artificially as well by taking a deep breath in, holding the breath, and then letting out a deep sigh. Dropping your shoulders. Doing this will make you feel automatically a bit more relaxed. Another very simple technique is to set your timer for 1 minute and just watch how many breath cycles you take in a minute. So 1 breath cycle is in then out. It's not a competition. You just try to count how many breath cycles you take in the space of 1 minute. You may take 10, 12, 6, or 8. It doesn't matter. Just count. And the act of doing that, many people feel it felt like a lot longer than a minute. People will feel very relaxed. You're beginning to evoke that relaxation response. Another one that you can do while you're doing anything else, so I can do it right now, is to breathe slowly. Breathe in slowly, more slowly than you usually do, in a conscious way. And breathe out slowly, in a conscious way. There are dozens of ways to do this. Pranayama techniques, as they're called in yoga. People recommend different number of seconds for in and out, but just doing it slower than you usually do is fine while you're comfortable. Breathing in more slowly than you usually do, and exhaling more slowly. So you could all do this while you're listening, and you might feel your body respond immediately. So that's one thing to do to start to activate your body's innate healing capacity. The next one is social relationships. Social relationships don't just make us feel better. We all want to have friends and family around. It's actually beneficial for your health. Now, I've reviewed studies and published a paper that included more than 1 million patients. And there's no doubt that being connected to friends and family and social groups is good for our health. It reduces stress, reduces depression, improves quality of life. It even reduces the risk of heart disease. And the opposite's also true. Being socially isolated is as bad as smoking. Both smoking and social isolation take away 5 years from our lives. Now, of course, during this coronavirus lockdown, many of us have been forced into isolation. Many still are. It's really important to stay connected in these cases. There are dozens of ways nowadays from, I still remember when there was just a telephone, but now you've got phone, you got iPhone, you have WhatsApp, Viber, FaceTime. I probably don't even know all of them. So why do social relationships improve health? What's the mechanism? There are two main mechanisms. The first is we feel safe if we know we are connected, which reduces stress, and I've already covered stress. The second one is called the direct effects mechanism. That's the scientific word for it. Basically, when we have friends and family reaching out, staying connected, we can benefit from their collective wisdom. So if we have a little problem, we might ask them what the solution is, and this can reduce our stress. We might not be able to get out. Someone can go pick up our food for us. It can be very simple things that nonetheless have a beneficial effect on health. So stay connected. Stay relaxed whenever you can. Stay connected. The third thing I want to emphasize in this talk, I think is maybe the most important thing for humanity first, is altruism. Doing something for someone else is good for us. It sounds paradoxical, but it's true. Let me tell you a story, my favorite story about altruism. It's a true story. Now, at lunchtime on January 2nd, 2007, Wesley Autry was waiting for the subway in New York City, the 137th Street subway station to be precise. He was there with his two daughters, and on the same platform there was a student called Cameron Holopeter, who was in a wheelchair and who also was epileptic. Now suddenly Cameron Holopeter had an epileptic fit and stumbled onto the tracks. Wesley Autry instinctively jumped on the tracks to get him off, while someone held his daughters back. He was struggling to get Cameron off the tracks when he saw the train approaching. He couldn't get Cameron off the tracks on time, so he just pinned him down and ducked down as low as he could. The train came over his head and whacked his hat off, but they were both okay. Now, certainly, Wesley Autry saved Cameron Holopeter's life. Now, that's why he did it. What he might not have known, he was also improving his own health, because scientifically it's been proven in trials that people who do nice things for others have better health themselves because they help others. Here's one study. There are numerous studies. Researchers followed the experiences of over 10,000 Wisconsin high school graduates from their graduation in 1957 until 2004. Now, these graduates were asked 3 questions. They were asked about whether they had volunteered in the last 10 years, how often they volunteered, and the reasons why they volunteered. This is important. And the reasons they volunteered were then classified either as selfish. They said, for example, I volunteered for my own self-development or self-exploration, to feel better, to escape from troubles. Or the reasons were classified as altruistic, feeling compassion for people in need, or community service. Now, like the other studies in this area, this one showed that those who did volunteer in the last 10 years had better health. They were even less likely to die. But then what was even more striking is that if the reasons for volunteering were altruistic, the health benefit was greater. So if you volunteer for altruistic reasons, you will get health benefits. So you can't, it's paradoxical, you can't do it in order to get your own health benefits because that's a selfish reason. You must do it to help others, and as a side effect, you will reap the benefits for yourself, which is okay. Now, the research on the benefits on the importance of helping others is reflected in all major religions I'm aware of. Jesus said to give is more blessed than to receive. The Torah requires that its followers give 10% of their earnings to righteous deeds or causes. Helping the needy is one of the pillars of Islam, and charity work, known as dana, is a virtue in Hinduism and Buddhism. Altruism confuses evolutionary biologists, because if you think about it, how could altruism evolve? By random selection. Imagine at some time in the past, there was no altruism, then suddenly altruism gene randomly emerged in one of the people or chimpanzees. And this altruistic individual began to help others, then by definition, they were not helping themselves as much. So the others were spending more time than they were reproducing and eating. So by definition, the altruistic individual, they were going to have less chance of, their offspring would have a lower chance of surviving. They have fewer offspring, basically. So the altruism gene would die out, according to evolutionary theory. Another thing that confuses evolutionary biologists about altruism is that it encourages weaker genes to survive. If someone helps someone else, they help them because they're weaker. And then that weaker person survives, allows their genes to survive. So this might seem to weaken the species. In spite of this difficulty that evolutionary biologists have to explain altruism, it's pervasive in humans and animals. Wolves and wild dogs bring meat back to members of the pack who weren't present at the kill. Vervet monkeys will scream to warn each other of danger, even though it calls attention to themselves and they are more likely to get eaten by the predator. Mongooses support older, sicker, injured animals. Birds will help raise other birds' young. Termites will even kill themselves to protect their other termites from being eaten by invading ants. Now, the best evolutionary explanation for altruism, proposed by political scientist Robert Axelrod and evolutionary biologist W.D. Hamilton in 1981, is that we share genes with our close relatives. This means that if we help our pack survive, we help our own genes survive. So this contradicts the idea that it's the selfish gene, individual genes, that it's actually the group genes that survive together. And it means that it's just not true that we live in a dog-eat-dog world where individuals should crush the other one and to step on each other to get ahead. So it also means that we really are all in this together. It's probably one of the reasons why social relationships improve our health. How can we leverage the power of altruism? One thing we can do is a random act of kindness. I'm sure you might have all heard of that. They're getting quite popular. Now, a random act of kindness is just that. It's an act that's kind, and you do it for no reason other than you feel like doing something nice for someone else. A few years ago, for example, I was walking with my sisters in the park, and we saw an envelope on the ground, and usually in Canada in the parks there's no litter, so we picked it up thinking we could maybe give it back to the owner, but it was blank on the outside. We opened it up and it said, this is a random act of kindness. Follow your bliss and have a wonderful day. So that made me feel better, made my sisters feel better, and we went on to do the same thing, leave some envelopes in random places with similar messages. So I'd like you all, as I come to a close, to think of some concrete random act of kindness that you'll do today. Think of a specific act and a specific time you'll do it. It could be small. It could be forward paying for someone's cup of tea. It could be smiling and paying someone an appropriate compliment. Anything you want. There's so many options. I want you to commit to actually doing it now. A specific act of kindness at a specific time. Now, you may have noticed that the mere anticipation of doing something kind for someone else made you feel better. When you actually do it, you'll feel even better. That's your body, that's the thought causing your body to produce happy chemicals. You can ponder on that for a moment. Now, coming to a close, we don't know what's going to happen on the outside. We don't know when a treatment is going to be available for COVID-19, for coronavirus. We don't know when and if a safe, effective vaccine will be made available. We don't know how fast it will go away. We can't control it. We can, however, access our inner resources so that the viral pandemic is not accompanied by a pandemic of fear. 3 scientifically backed ways of accessing these inner resources are taking time each day to relax, connect, and give. Using these simple evidence-based tools will make you happier and healthier, will make the world around you happier and healthier, and will therefore make the world a better place. Thank you very much for listening.
Professor Howick, thank you so much. That was such a pleasure to hear, to learn, and I think by the questions that are piling in to my earpiece, I think we've got lots to throw in your direction. That was
Good.
quite an eye-opener, particularly for the challenges that we're facing as a society across all parts of the world. And the scientific basis that you've given to these techniques, I think will serve as a great source of reassurance for many that may potentially be skeptical about the body's ability to heal itself. And at this point, I will plug your book to all our audience, and I ask them to please get themselves a copy because it is a very, very good read, an award-winning book that highlights a lot of the stuff that you've talked about. But without further ado, let's go on to some questions, if that's okay.
Yes, thank you.
Before you mentioned about altruism, and you mentioned that altruistic actions across people of faith and people of no faith. And from a Humanity First point of view, we have a very interesting quote from the founder of the Ahmadi Muslim community that Humanity First was formed by. And the founder states, "My desire, my wish, my objective is serving humanity. It is my faith, my job, my inspiration, and my way." So exactly as you've said, that across the world, people from all backgrounds are involved in this altruistic work. So let me go straight to questions. This is a COVID-related question. How do I offer emotional support to friends and family members or co-workers who are actually quarantined and isolated at this time?
That's a great question, and it's something that we often get stuck in our own routines, and we have the intention, we're like, I'm going to stay in touch with people, but then we don't actually do it. So one of my friends, I learned that he has a spreadsheet, and I'm part of his spreadsheet. And he follows a certain routine for when he might call me. This is even before COVID. And when I first heard this, I thought, well, that's a bit robotic. It's not very warm-hearted. But then I realized if we don't put it into a kind of a routine, we often let it go for too long. We realize time flies. So I would say do that. Make a list of people who you think would benefit from just calling and saying, hello, I was thinking about you. How are you? How's it going? That's all you need. It's very simple. But then make a list and go through it in a kind of more rigorous way, especially now, because otherwise someone who needs to hear from you could slip through the cracks if you don't do it in a kind of more organized way now.
Thank you very much. The next question, I believe, is from the States. And the questioner asks, I'll just try to put it in a succinct way, is during this current COVID crisis, particularly in the West, we and in developed countries, we're being faced by a barrage of guidance, and I think, Professor Howick, you alluded to it in your talk as well. The questioner asks, who do I listen to? Do I listen to the state? Do I listen to my doctor? Do I listen to my friends? Yes, I am confused, and sometimes I can't tell the difference between what is science and what is fiction.
This is a wonderful question because, as I mentioned, there is scary news out there, and that scary news becomes scarier when you add fake news to it and conflicting news to it. And now, because I can hear that in Sweden they do one thing and the UK do something else, what's the right way? What's the wrong way? Um, what I would say is I'm not qualified to make a pronounce on which government and which body is giving the right advice. What I would say is that the three things I suggested today apply no matter what the advice you're following is. Relax, connect, and give. And then the second thing I'll say is there's not that much new to learn every day. So I would say that limit the amount of time you spend every day listening to news. Just get a minimal update. What's the new news you need to learn today? What's the update in terms of the rules in your own country? And then shut off, because it can be a barrage and it creates a stress response and a nocebo effect. So I would say those three things I said apply, and limit, drastically reduce the time you spend looking at news. Because it's mostly bad news.
It is. Next question, I'll quickly go through. Next question, the questioner asks that in your professional opinion, where do you feel we as a society will go on from this COVID crisis? Clearly, a lot of new concepts are coming through, and a lot of questions we're asking each other as a society, which hitherto were not really mainstream.
Yes, that's a fantastic question. I've written about that actually, and what I am working towards is for us to take the good things from COVID. What are the good things? Well, I've never been so well connected to my neighbors. We formed a little community here. I mean, when I had a baby during lockdown 2 months ago, and our neighbors helped by bringing food and so on, we subsequently helped them a little bit. So we realized that we need each other more than ever. So these kind of new social relationships that we're creating, I hope they're maintained. I think people have also realized to appreciate the simple things. So, they're going out and eating less in restaurants. And I've got friends who own restaurants, and of course, hope they come back and bounce back. But we don't need all those material things. They're wonderful, and we want to enjoy them, but they're not going to solve these problems. So I think when we go forward, I hope we remain connected to each other. We appreciate the simple things, especially being connected as families, as friends, and as humankind. The other great thing is that creativity. Look at this webinar. I mean, the number of things people are doing in their own homes to create their own futures, their own vocations is also fantastic to see. So I think we leave the negative aside, all that kind of leadership problems and the bad stuff, leave that all behind, and let's all work towards making sure that the positives are maintained as we move out of this COVID-19 crisis.
Thank you very much. The next question I have is more focused on policy and on health policy, and it's addressed to Professor Howick. Where do you feel the future is for health policy across developed health systems in the world in light of what we're experiencing at the moment?
Well, I think that, like I said, we need the external stuff, the treatments, the trials, the safe, effective vaccines. However, just as this pandemic came, it was actually predictable. Not the COVID-19 virus itself, but that a pandemic would come. They all knew it was going to come. Every country, or almost every country, had a pandemic plan. So there'll be another one. This one might not go away so fast. There'll be another one. And to be resilient in the face of that, we need those external things, the treatments and tests, but we also must create a more resilient society. And the virus attacks people who are the more vulnerable hosts. So the society, the policy can be changed to make sure that we're as resilient as possible as a population, which involves engaging in these mind-body techniques, involves addressing problems that can be partly solved by people's own actions. So, obesity is partly genetic, but it's also partly under our control. So making it easier for people to do safe exercise, um, making it easier for people to make healthy food choices, and so on. Reducing inequalities, of course, as well, because there's the virus attacks different people in different ways. I mean, those at the lower end of the socioeconomic spectrum seem to be affected much worse than certain minority groups as well. So, I mean, society will never be 100% equal, but making sure that we have a resilient population, I think, is the way I'd like to see policy move forward.
Thank you very much. Excellent. That very helpful for us as humanitarians as well. And if I can ask from a humanitarian point of view, clearly during this crisis, NGOs and groups across the world, Humanity First and many, many others in that light, as you've mentioned in your talk, are there assisting people within this crisis. Now, prior to COVID, we've had this discussion about how humanitarians can balance the altruistic desire that they have in terms of assisting someone and maintaining their own mental well-being, but ensuring that desire does not then overreach and with an altruistic intention actually creating some degree of harm in the people that we're trying to help.
Do you mean by making them dependent?
Potential dependency on one hand, and on the other hand, imparting something that we do that we may feel is helpful in a particular area because of our altruistic desire, but the thought and the necessary assessment has not necessarily gone into it.
So two things. One is, how do those who are helping make sure their batteries are plugged in? And those three things I mentioned are particularly important. I would add one further technique, which I teach when I teach empathy, because some doctors say, well, the more empathic I am, the more tired I feel. But others say, no, the more empathic I am, the more energized I feel. So how do we make sure that we're feeling energized so that we can give more? And the way to do that is to do what we do mindfully, using techniques like the relaxation response I described, like the relaxation techniques I described. One from, there's the compassion meditation, just feeling, doing what you do mindfully, you'll see that you won't be burned out by the end of the day. And then in terms of making sure that we are actually helping, so our intention to help is actually, borne out. The best thing for that is evaluation. So there are different organizations. I'm sure what you do is obvious. I mean, the food bank obviously helps people. If they're hungry, there's no point of there's no question they need to be fed. I mean, unless you get in some kind of twisted reasoning by which people say, well, if you help them, they won't rebel against the government. But that gets into a huge tangle. People are hungry, you've got to feed them. But evaluating, I've no doubt that you do. I've read about your charity, and it gets top marks. Yeah.
Very kind. That's very kind of you, Jeremy. I think
No, it's
we're
known for specifically. It's known for being very efficient, because many charities, of course, you donate $1 or £1, and you find out that 90p or 90 cents goes to the administration of the, and then 10 cents goes to the person who needs it. Whereas Humanity First, what I've read suggested it's the other way around. It's the administration cost is very low.
that's really, really kind of you, Professor Howe. Yeah, that's absolutely right. I think that's mainly due to a huge workforce of doctors, scientists, engineers, disaster responders that work on a voluntary basis across the world. Yes, yeah, you're absolutely right. And I think the control room is telling me that time is soon coming to an end. I'm just trying to flick through as many of the questions, see if I can actually put the pertinent ones to you, if you don't mind. Next question I have here is again on health related and health workers. We've seen all the tragic images from Italy, from New York, from Brazil, where you've got paramedics, ambulance workers, and the intense degree of pressure that they've been put under. And the questioner is asking, is there's two things. There's how they deal with that pressure, which you've talked about, but when they come back into their home lives, it's something that military people see when they come back into civilian life. How do they interact with their own loved ones, having seen such trauma? And maybe people don't actually realize what it is they've experienced. And sometimes there's a degree of anger and resentment that I've been through a war zone, and people don't actually realize what I've been through. So the question is asking, how do we deal with those complexities?
The big answer to your question is we need to, the system in whatever country the person who asked the question lives in and other countries need to be much, much, much nicer and kinder to the healthcare workers who are absolute heroes, and we notice it now. There's a huge problem with burnout among healthcare workers. Their mental health is lower than average because they're being overworked. They have twice as much time being spent filling out papers and forms than treating patients, and then they're being evaluated and so on. The way we treat healthcare workers in general is very bad. So that needs to change, and that has to happen at a higher level. At the lower level, being mindful and so on, and the techniques I recommended will help. And then the second thing I would add is that healthcare workers, at least they are valued in society. If someone says, I'm a doctor, people are impressed and so on. But the other key workers in this situation are the kind of delivery drivers, people working at the shops. They've been on minimum wage and underappreciated, and we didn't realize how much we needed them until now. So now, I've got my father-in-law's a delivery driver, and he's been getting, he never used to get tips. People now, they say thank you. They used to kind of get angry if he was 1 minute late. So it's not just that the healthcare workers, it's a big problem. We don't treat them well enough. And in general, we don't treat people in society well enough. We should value people for the work they do and thank them. And there's no need to be so inefficient in the way we treat them, which causes mental health problems.
Professor Howick, thank you so much. The time has flown. Unfortunately, I've not been able to go through all the questions. Can I thank you? Thank you from the bottom of our hearts for the time that you've spent today. And before we close, I'd just like to let our audience know. Firstly, this keynote address will be available on YouTube after the event on hfuk.org. And in terms of some of the work that Professor Howick has mentioned, on the screen, you will be able to see links to that. One of them being a special 8-week wellbeing course that Professor Howick runs. And he's done a special discount for people up until the 15th of July. So if those that want to join that course, the coupon that they need to put in is BEHUMAN, BEHUMAN. That is the code that they will need to apply, and the links will be on your screen or on the YouTube link. You can follow Professor Howick on Twitter at Jeremy Howick, one word, or you can follow his work on his website, jeremyhowick.com, and again, the details will be on your screens. Professor Howick, once again, thank you so much, and I think we can all benefit from what you've discussed today on an individual level, on a society level, and on an organizational policy level. Thank you very much. And to our viewers, we will be joining you again in a fortnight's time, where we have Professor Sharif, Professor of the Circular Economy from Bradford University, that will share some of his thoughts on the circular economy and the impact with COVID. Ladies and gentlemen, Professor Howick, thank you very much.
Thank you. It's been a great